Good afternoon. My name is Yeong-yi. I'm head of Medical Service Innovation Division of KIDI. I'm going to talk about smart healthcare for protecting citizens' health in the sustainable and safe city session. So my presentation is made up of 5 sectors. First, it's about changes in the health and medical environment, how it has been changed over the past years. So let me talk about the environment changes. And second, according to the medical environment changes, how smart healthcare has been evolved will be explained. And third, in a smart city, what is the smart healthcare? For example, disease prevention and also the treatment. So we'll talk about service model for disease prevention health management. And then I'm going to talk about service model for disease diagnosis and treatment. And lastly, I would like to talk about Digital New Deal smart medical implementation, which is a part of a New Deal led by the Korean government. So first, there have been a lot of changes in the health and medical environment. As you know, that the aging population and increase in medical expenses are the first in changes. So the number of the elderly people aged 65 and over it was 15% in 2019, but by 2060, the portion of these people will go up about 40%. So it will go up by 3 times. Triple. And also, the number of domestic baby boomers are going to increase. And so by 2026, the country entered a super aged society, and by 2050, Korea will be the world's second largest aging country. With this aging population, there will be a lot of chronically ill patients, and national medical expenses will be also go up. So this will act as a burden of support for each citizen, and also it is a financial threat in the future of the government. In fact, the share of medical expenses for the population aged 65 and over has been on the rise. And also, medical expenses for the elderly accounted for 12.4% of medical expenses in health insurance and 40.8% of all medical expenses. So the rate of increase in elderly care expenses exceeds the increase in total health insurance. And the proportion of the elderly population is expected to intensify further. So in the chart, you can see that the trend of aging population is leading to a continuous increase in medical expenditures in each country. So in our country, I'm sorry. And you can see, so second changes in the healthcare environment is the changes in disease structure centered on chronic diseases. And also with a lot of chronic the degenerative diseases are emerging, and also acute diseases are coming up. So the aging and lifestyle changes are accelerating the transition to chronic degenerative diseases, resulting in a rapid increase in social costs. The World Economic Forum pointed out that the increase in chronic disease as a significant and probable threat, and the economic cost of 5 chronic diseases is expected to reach 4% of global GDP. And also, the increase of the chronic diseases also reaches the high rate of death, which means after treatment, that care for the survivor, the increase also increase the cost. And so I'd like to talk about the new disease last year and this year, the outbreak of COVID-19, and also the increased mobility across the regions, and so that the world is not free from the infectious disease. So due to this infectious diseases, there's a new, the emerging needs of the healthcare. So, for example, the severe acute respiratory syndrome, SARS, swine flu, Middle East respiratory syndrome, MERS, and COVID-19. So new infectious diseases are coming up in a cycle of 5 to 7 years, and also the antibiotic-resistant bacteria and zoonosis are also increasing. So with these the factors, the aging population and also ease of mobility and also diseases emerging, those are the major changes that we say that we need a new change, a new development for the healthcare sector. Along this, we see that the increased care complexity and also the increasing patient engagement. And care is taking place not just in hospital, but also at home. So there should be certain connection between the cares in hospitals and home. And also we need to take a very multidisciplinary approach to diseases. And also with the development of diagnostic capabilities and biotechnology, the demands are coming very complex and various care models are emerging. And from the patient's perspective, they see that a lot of channels, they can earn the information about their disease and also their needs for the treatment. Individualized needs are also increasing with the new disease emerging and also increase in the chronically ill the patients are also increasing the burden for the healthcare workers. So in Korea's healthcare personnel, you can see that the statistics, there are fewer clinically active personnel than the OECD average. And also the shortage of personnel, healthcare personnel is expected to continue. As you can see, the COVID-19 outbreak, we are expecting to see that the medical staffs are suffering from excessive work and burnout. And also, in particular, it is difficult to supply medical personnel in specific fields such as obstetrics and gynecology and psychiatry. So the lack of medical personnel is a risk of deteriorating the quality of medical services. So far, the quantitative and labor-intensive healthcare personnel we pursued, but this will not meet the needs of the changing environment. So against this backdrop, we see that the increasing burden on the government budget and finance, and also it will increase the financial burden to hospitals. And also we see that the hospitals should deal with the chronically ill patients as well as the new emerging diseases. So without any the particular methods to deal with that, the burden on the hospitals and the government budget are likely to be very deteriorated. So in our medical expense is increasing dramatically. It is not seen in any other sector. Fortunately, digital innovation is the one that we can see as a solution. So digital technology and technology innovation can be combined with the medical technology. So we see that the boundary between digital and medical technologies are breaking down. And also, the medical care is the primary application field of digital technology. So without digital technology, we cannot say that the medical care. So we need to provide the predicting and preventing disease and customized treatments with the digital technology. And also the electronic medical record and also genome analysis and also digital technologies outside of the existing medical system will take the lead in the medical healthcare area. There will be a lot of applications, the digital technology into the medical sector. So IoT, wearable devices, big data, we can see that the high ICT infrastructure development and also their perfectness is almost in a full swing. And also there are a lot of development of healthcare products and services that enable the collection, storage, and interpretation of medical information, enables a lot of changes. and various healthcare products and medical products will be emerging thanks to this technology innovation. So, in conclusion, the development of ICT technology is accelerating the paradigm shift in the healthcare field, and in particular, big data technology is expected to play a pivotal role. In brief, so what have been changing in hospital services after COVID-19? So after the COVID-19, the hospital and medical institutions are seeing the hospital structure changing into two tracks of infection and non-infection system. And also the outpatient and also surgery and also discharging. This cycle of patient flow is not appropriate for the chronically ill disease. So we need to look at this patient flow again, and then how we can improve the patient treatment, whether we can approach with a contactless or face-to-face treatment. So there has been a significant changes in the service providing. And lastly, in order to provide a safe medical treatment environment, how we can adapt digital technology, not just to the diagnosis and treatment, but also to the administration and operation of hospitals, including logistics. So hospital smartness is going to happen. So based on network comprehensive system shift, we need to build this kind of system and also cope with the future demands in the medical sector. So local community based on the healthcare, also within the regional healthcare, and also tertiary and secondly, hospitals will be mobilized to cope with and provide a smart healthcare. So the future healthcare is taking place in an urban area, in smart city, so that we can say that it's a smart city healthcare. So in a smart city healthcare, how people can enjoy their health and reducing the health cost. So in a smart healthcare, e-health and m-health system or intelligent system, AI and interface connected device are going to be emerging. Not just the state-of-the-art technology items, but also the smart tools, smart healthcare system, and the accompanied medical device is going to be developed further. So left side, you can see that the market outlook by major smart city services, and right side, you can see that the left side you can see the city platform market forecast, and right side you can see the market outlook by major smart city services. So you can see that there will be a lot of smart city platforms, the healthcare platforms in a smart city. So what is the direction of the government? So in May 2019, the Korean government established and implemented a national strategy to secure competitiveness in the biohealth field even before this COVID-19 outbreak. So first one is that the big data and data center hospital and new drug candidate big data or patent big data and public health public big data. You see that the government has already noticed the importance of data by promoting 5 big data platforms that just I told you. And also, through the economic policy direction for the second half of 2020, the Digital New Deal, Green New Deal, and Job New Deal were promoted by the government. So in particular, through the Digital New Deal, DNA, Data Network AI, the ecosystem was strengthened, and also digital was embraced, and also safety net was built. So you can see that the smart healthcare service model is below. So in a prevention stage, before you go to the hospital, you can also enjoy health at home through the preventive services. And also there is a government-led the preventive services you can see on the left and right side. So when you have a disease, you need to have a quick diagnosis, and also you need to enjoy a good treatment. In a smart hospital, how you can make a good diagnosis and treatment, and also what about the smart medical emergency services? You can see that there are major functions in a smart city services. So you can see the major services of smart healthcare, smart home-oriented healthcare service. So your neighborhood or the nearby work, you can figure out your health status and then also secure the data about your health, which will be used for the prevention of any disease. That's one factor. And the other one is the intelligent infectious disease response services. So in city, different sectors, for example, traffic, environment, and disaster, those sectors are connected to the intelligent infectious disease response service. And second part is diagnosis and treatment. As I told you before, the diagnosis and treatment are provided by hospital mainly. So when I say smart hospital, it's not just about tertiary hospital. It includes secondary and tertiary hospital, and also the small clinics, and also it includes nursing homes. So patients can get the treatment through these medical providers, and also they can enjoy good health when they go back home. So services include all of those provided in hospital, but you can also get the services on the road, at home, and any the different places. How city can provide emergent the medical services in an integrated way. That is the smart emergency medical service, which also use transport and environmental factors. So here in this smart city, the healthcare data is also the data, integrated data, which is also linked to the big data integrated center and data center. So when I say the big data center, it is not a single data center. It's the center they can connect it to the server center and also distribute center, which include healthcare center and also others, the centers. This healthcare data center can store the individual health record. So in an eco-smart city, how we can use the healthcare information for eco-smart city healthcare services. First one is that you can see that the personalized data and also the data coming from the device. So medical data and lifelog data are the ones to cater to the individual health. And also weather data should be used as a very important factor for maintaining the health. Last one is that transport data and also location data. So all the data that you can come across in the city. In a smart healthcare, the government and medical institutions as well as other the entities will be included. So as I told you before, big data center will play a critical role, and also healthcare providers or institutions will also play an important role. And what we can see as an entity as the medical device or medicine provider. And also you can see that the healthcare management service providers. And also telecommunication companies and platform providers are the ones in our ecosystem, including the insurance company. So let me talk about smart home-oriented the healthcare services, as well as the infectious disease response system, and also emergency system. So in a smart home center healthcare services, you can see that the healthcare-related data will be collected, and this data will be transmitted to the big data center. And also in the big data center, you will see that the healthcare will be monitored, and this data will be connected to medical service provider. And next one is that the intelligent infectious disease response system This means that we implement, establish, and operate the intelligent infectious response system. And the third one is that the smart hospital-oriented medical service. We establish and operate smart medical and operate system, and it will be also connected to other health management service providers. So medical institutions will run with the system which will efficiently use resources. And next one is a smart emergency medical services, which means that the developing the technology to cope with or respond to the emergency situation. Last one is about digital New Deal, smart medical implementation. And I would like to talk about the smart hospital leading model development support project in the part of this digital New Deal. So this has been led by the hospitals or medical institutions. So digital technology is now applying to the operation of hospitals. So developed models can be applied to the secondary and other the medical systems. So in 2020, we developed the tele-ICU model. So tertiary hospital and secondary hospital, the patients in ICU have been taken care of by doctors in different institutions. And second is that the infectious disease management solution. If there is any infectious disease patients you can find in a hospital, you will immediately deal with them and then provide the infectious prediction, management, and response. So how you can optimizing the resource management in hospital? That's the resource management solution. So we started the in-hospital patient safety management in 2021. So you can see that the falls and bed sores, those kind of the risks will be classified immediately and provide the appropriate treatment to patients. And also we have a smart special word, which means that not just person, but also the robots and other systems will be mobilized to take care of patients. So when I say the digital New Deal smart medical implementation, there are all the entities in the communities, and they will be all mobilized to provide a better health care. And so we can see that the hospitals and the government and also the people are the entities in a better healthcare control in the country. That's all. Thank you very much.